Happy Wednesday morning, March 25th, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Wednesday morning, so let's begin. First up, DHHS person with COVID-19 rode Concord coach line bus 4 times. Health officials announced 7 new positive COVID-19 tests right here in the state. Let's take a listen to this video from WMUR News 9.
Breaking tonight, health officials now confirming 7 new cases of COVID-19 in the Granite State. That brings the total number of cases in our state to 108.
Officials are now warning about potential exposure. They say a person infected with coronavirus rode the Concord Coach Line's buses 4 times earlier this month.
Now, according to officials, the person rode the 3:15 a.m. bus from Concord to Boston's Logan Airport on March 11th. Now, the second trip happened on March 13th. The person rode the 5:40 p.m. bus from Boston Logan Airport to Littleton. March 14th, that person took the 5 a.m. bus from Concord and ended up at Boston Logan Airport. And then 2 days later, on the 16th, that person rode the 1:40 p.m. bus from Logan Airport to Concord. Officials are telling anyone who rode those buses to self-isolate.
In a statement, Concord Coach Line says, quote, the drivers of these trips were taken out of service as soon as we learned that a rider had tested positive for COVID-19. And it says it has taken dramatic steps to clean and disinfect the buses.
Okay, and there you go on that video and that report. COVID-19 in New Hampshire. Let's take a look what you need to know. A 108 number of people in New Hampshire who have tested positive for COVID-19. 582 number of people worldwide who have tested positive. 1 number of deaths from COVID-19 in New Hampshire. 13 number of people hospitalized with COVID-19 in New Hampshire. 703 number of deaths from COVID-19 in the United States. 0 people in Coos that have COVID-19. 21 people in Grafton that have COVID-19. 7 people in Carroll that have COVID-19. 7 people in Belknap that have COVID-19. 5 people in Stratford that have COVID-19. 4 people in Merrimack that have COVID-19. 1 person in Sullivan that has COVID-19. 1 person in Chester that has COVID-19. 20 people in Hillsborough that have COVID-19, and 42 in Rockingham that have COVID-19. And in this graph right here that you are looking at right now, new cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases. As you can see, it went up here on March 22nd and then dipped down here. Also, you can see in the orange, new hospitalizations, and then in the red are the deaths. Common symptoms: fever, cough, difficult breathing, how it spreads, and prevention tips. Sununu announces volunteer initiatives to help states' COVID-19 response. Efforts aimed at migrating strain on health services, providing protective gear. Let's take a listen to that video from WMUR News 9.
I can't imagine what it would be like to have to suddenly leave my home. Where to take my family.
As the state prepares for a possible surge of patients dealing with COVID-19, officials are looking for volunteers in the medical field.
We're looking for those that have retired from practice, people that have gone into more an administrative role, maybe doctors and nurses that may be furloughed right now.
The state will remove barriers for them when it comes to licensing. Officials are also looking for current medical staff.
If you say the average nurse cares for 4 to 5 patients, and they need to care for patients over 3 shifts a day, that's a lot of nurses.
The Nursing Association has contacted 10,000 nurses. So far, more than 400 of them are willing to help.
The majority of our respondents are currently licensed, which means more than likely they're actively working in probably pretty busy jobs right now, but they're still willing to volunteer in some capacity.
32 school nurses are also on board, information that will be given to the state.
We've also reached out to all the acute care centers in the state, over 30 hospitals, letting them know that we've gathered this data, that if they want access to it, all they need to let us know, and we're sending that information out to them as they reach out to us.
Now, nurses are being encouraged to sign up through the state. That information can be found on our website, WMUR.com. We're live in Concord tonight. Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. Flex area for overflow patients set up at SNHU. Facility would only be activated if needed, officials say. Let's take a listen to that video from WMUR News 9, Mike Cronin.
Dozens of beds line the gym floors of Southern New Hampshire University's Fieldhouse. This is a ready-to-go operation, but it's one that those who designed it hope will never be used.
This is not Plan A, it's not Plan B. It's, more like Plan C.
It's called a flex area, a 250-bed facility split into 2 rooms, one to treat COVID-19 patients and another to treat non-COVID patients. Governor Sununu and city leaders getting a tour this afternoon. If Manchester hospitals reach capacity, those in less serious condition could come here, freeing up hospital beds for those who truly need them.
Patients will be referred here directly from the hospitals and discharged here at the direction of the hospitals.
Catholic Medical Center and Elliott Hospital would be in charge and would staff it.
We've engaged Dartmouth-Hitchcock because they obviously have a very large ambulatory practice in the city, the VA. So we're really looking at what can we do with all of our available resources.
This is one of at least 7 flex areas being set up across New Hampshire by the National Guard.
This is what we do, right? We do this overseas quite often, is stand up sites and get them going and get the logistics right.
All of the beds and equipment were in storage in Manchester in case of an emergency.
The local community has come together to do some really proactive planning for what might be down the road.
Other locations are expected to be operational in the coming days, including one at Nashua High School South. And Governor Sununu says they're also speaking with UNH and other schools. Reporting live in Manchester, Mike Cronin, WMUR News.
Okay, and there you go on that video and that report. Laconia police make changes after officer quarantined with COVID-19. Police tried to limit interactions to prevent the spread of the virus. Let's take a listen to that video from WMUR News 9.
At Beltate's, customers will find everything they need for a building project. The brand names you trust to perform. And with a fleet of over 50 delivery vehicles, we deliver when and where our customers need them. Beltate's Building Products. 9 locations throughout New Hampshire and Massachusetts.
In Laconia, the police department has been hit with a positive case of COVID-19. A male officer in his 30s, he has been in quarantine for 7 days and is doing well.
You know, it certainly had a ripple effect throughout the department, and has certainly, everyone has felt it here.
A trainee who was working with that officer is also in quarantine and doing well. The department is now taking protective measures to guard against the virus, such as closing the lobby and taking reports over the phone.
They'll include some changes to scheduling and shift design with an idea of to get more uniformed officers on the street.
Statewide, 182 chiefs are in the New Hampshire Association of Chiefs of Police. It's a great resource for departments to share information and see what is working across the state. Hanover Police Chief Charlie Dennis is the president of that association and says many of the towns have locked down their communication centers.
Yeah, one of the biggest concerns for first responders is making sure we're getting the call information out to officers on the street. So it's extremely important to keep our communications personnel healthy during this time.
And Chief Canfield says due to the nature of the calls, police cannot always wear personal protective equipment, putting them at extra risk. So limiting interaction, like it is for all of us, is a key. Jamie Staten, WMUR News 9.
Okay, and there you go on that video and that report. Some Portsmouth restaurants closed for good in wake of COVID-19. Owners say they can't wait out efforts to slow down virus. Let's take a listen to that video from WMUR News 9.
With over 100 restaurants in Portsmouth, there are more restaurant seats than residents. Some, like Vita Cantina, adapting to takeout, even doing frozen dinners and margarita mix to go.
Nothing's out of the realm of what we can try to make happen to survive during this time.
Some restaurants closing temporarily, but a few, like Lure that opened in late 2018, posting online it will not reopen.
That's just heartbreaking. These folks have put their time, their lives, their savings, their families, everything has been put into these businesses, and then within 2 weeks, done.
Once that cash flow gets turned off, everything comes to a screeching halt.
Chef Brendan Vesey won the New Hampshire Food Bank Steel Chef Challenge in early March and closed one of his 2 restaurants a week later.
And not knowing how long this would go on, I just kind of knew that Joinery wasn't going to be able to survive that.
Adapting his Botanica restaurant and gin bar to takeout, not really an option, but his hope and dream is it will survive.
It really depends on how long this goes on and what kind of release small businesses are going to get.
What are the terms of the loans? How much is the loan amount? What's the interest rate? When do they expect it to be paid back?
The impact isn't just on individual businesses and their employees, it extends to the state. Portsmouth alone puts $34 million in meals tax revenue into the state coffers each year.
Right now in my head, I have basically like a 3-month plan. And that's just being like, who knows how long this is really going to last.
In Portsmouth, Jennifer Crompton, WMUR News 9.
Okay, and there you go on that video and that report. Nashua shuts down regular bus services to slow the spread of COVID-19. Smaller buses will run by appointments only. Let's take a listen to that video from WMUR News 9.
Jonathan Winfield says he takes a Nashua bus just about every day.
Right now, I currently don't have a car, so it's pretty important. Like getting from and to home and work, it's essential right now. So them shutting it down, it puts a real damper on a lot of things.
Starting Tuesday night, all fixed-route bus service in Nashua, the city's normal daily lines, will be suspended because of the COVID-19 pandemic. They will move to a by-appointment only system using the smaller paratransit buses, taking passengers on only essential trips to things like the grocery store, pharmacies, or doctor's appointments.
We know that within one of our large buses, this is a place where 5, 10 people or more can gather in a small place. The disease could easily spread if anyone had it inside the bus.
City officials say they know the impact that this is going to have on people's lives, but for now, it's the appropriate thing to do. Appointments can be made through the Nashua Transit System. About 4 to 5 buses will be running at any one time. Jonathan Winfield says he's already looking for other options.
Right now, I'm just looking at the alternatives. Taxis, Ubers, Lyfts, friends if they can. Just got to make it work however I can.
Mayor Donches says he doesn't know how long this shutdown will last. In Nashua, Andy Hirschberger, WMUR News 9.
Okay, and there you go on that video and that report. Stocks features rally after White House Senate reach deal on coronavirus bill. Stock features were surging again in early Wednesday morning trading, following Tuesday's historic rally as the White House and Senate reached a deal on the coronavirus bill. The country's war over the virus. Let's take a listen to that video from ABC News.
Good evening, and it's great to have you with us here on a Tuesday night, and this is yet another heavy night of news. President Trump with conflicting messaging today on the coronavirus. After the White House pushed social distancing to halt the spread of this, to give doctors, nurses, and healthcare workers a fighting chance against this, today the president signaled he wants the country open by Easter. It left medical experts, members of his own, to answer questions about whether they would offer that same guidance. As health experts say, we are not even close to seeing the worst of this yet. Tonight, the number of cases in America now more than 53,000, nearly 10 times more than just a week ago. More than 670 are now dead. At least 22 states imposing stay-at-home restrictions, 4 more states in just the past 24 hours. Empty streets from Boston to Detroit to Dallas tonight to California's Pacific Coast Highway. The most cases nationwide now in New York State, the number doubling every 3 days, the vast majority of those cases in New York City. And these are the lines today outside Elmhurst Hospital in Queens. At first, 400 ventilators from the federal government arriving in New York at the city's emergency management warehouse. New York's governor asking the feds, the White House, do you want a pat on the back? We need 30,000, pointing to the nation's stockpile, begging the federal government for more help. The governor saying what happens here will happen across the country. And the images tonight that caused alarm, service now reduced in New York City and in so many other cities. And look at this, the crowded subway car. This is in New York City at 5:30 this morning. There is new concern in many parts of this country tonight, including Louisiana for one, just weeks after celebrating Mardi Gras. The governor there now saying its medical resources will be overwhelmed in a matter of days, calling for a major disaster declaration. Tonight, the Pentagon sending 2 Army field hospitals to New York, another one to Washington State. And as I mentioned, Dr. Jen Ashton with your questions tonight and news of a possible test on the horizon that just might be able to show whether you've already had coronavirus, if you might have any immunity to it. So we will carefully guide you through it all again tonight. And we begin with ABC's Chief National Affairs Correspondent Tom Yamas, who interviewed New York's governor just today.
Tonight, as the coronavirus spreads through the country, President Trump warning the restrictions may infect the economy to a point of no return. The president now saying he wants the U.S. open for business by Easter. That's in 20 days.
I will tell you that right now. I would love to have that. It's such an important day for other reasons, but I'll make it an important day for this too. I would love to have the country opened up and just raring to go by Easter.
Later adding he'd like to see churches full.
I would love to aim it right at Easter Sunday, so we're open for church service and services generally on Easter Sunday. That would be a beautiful thing.
President Trump comparing the more deadly coronavirus to the seasonal flu.
We lose thousands, I brought some numbers here, we lose thousands and thousands of people a year to the flu. We don't turn the country off, every year.
The president's own team pressed whether the country should be easing social distancing within weeks, not months.
I think the question is really, can we be laser focused rather than generic across the country? In other words, can we use our data in a laser focused, granular way to really look at what's happening on the ground and adjust our public health messages based on what is actually needed by the number of cases?
Right now in New York, people are dying from COVID-19. The country's hot zone, the infection rate doubling every 3 days.
One of the forecasters said to me, we were looking at a freight train coming across the country. We're now looking at a bullet train.
A frustrated Governor Andrew Cuomo predicting the virus's peak in New York will be faster and higher than expected. 140,000 hospital beds and 30,000 ventilators needed now, calling on the federal government to help get it done.
When we went to war, we didn't say, any company out there want to build a battleship? Who wants to build a battleship? Anybody want to do that? That's not how you did it. President said it's a war. It is a war.
FEMA setting up this field hospital in New York. The Javits Center where we are right now is not only going to be a hospital, it's also going to be a distribution center. And here's some of the supplies. You have cots, hospital beds, latex gloves, and the critical piece of equipment, the ventilators. Today I asked the governor about the president's push to reopen the country. To President Trump, what would your message be about balancing the economy versus making sure this no longer spreads?
We have to be smarter about it. You can't sacrifice human life to get the stock market up. That is a repugnant concept. There is no dollar figure on human life in this country, and there never should be.
In New York and across the country, doctors telling us tonight what it's like.
We are soldiers very much in the bunker fighting this invisible virus. And we enter the trenches every day when we go into the hospital.
Right now, it feels like I'm fighting a fire with blindfolds on.
We're now learning 2 healthcare workers from Georgia have died from COVID-19 infections. Gabriel Najato, a physician's assistant in Atlanta, fears exposing his family to the virus.
It's been tough not trying to be as close with my sons because I'm worried about getting them sick.
In Oregon, a field hospital going up. In Wisconsin, a rush to donate masks. And the Ford Motor Company now starting to manufacture medical face shields. The virus infecting people from all walks of life. Senator Amy Klobuchar, who just ran for president, telling us how her husband is now hospitalized and on oxygen.
He was coughing up blood and his oxygen levels were dangerously low, so he's been there for a few days.
She says one of the hardest things for affected families is not being able to see your loved one.
I would rather be there with him right now. And I can't do that. All you can do is call and email and text and try to reach the caretakers who are taking care of them. I've never even met them to get updates.
Senator Klobuchar talking about really the situation so many families face when their loved ones get taken to the hospital in these emergency situations and then they can't visit them. They just have to hope and pray from a distance that their loved one gets better. Tom Llamas back with us again tonight. I want to get right to the news moments ago, Tom. We heard from the president who reiterated his hope to get this country back open by Easter, but he said he would be guided by Dr. Fauci and Dr. Birx, who we've all come to know, standing behind the president. And Dr. Fauci did weigh in on this.
That's right, David. This news just came in, and Dr. Fauci was very, very clear about this. The president may want to reopen the government on Easter, but Dr. Fauci has told him, he told him in the Oval Office, they have to be flexible. They're going to look at this from a day-to-day basis and see if that's even feasible. But he also points to New York, saying if you look at New York right now, Easter Sunday does not look like it's feasible to reopen New York. David?
And quickly, Tom, before I let you go, Dr. Birx also weighing in a short time ago saying those who've recently been to New York City should self-quarantine in their homes for 14 days as they return home elsewhere around the country.
Yeah, this was a pretty big headline, essentially agreeing with the governor of Florida. They said if you live in New York City and you left because of the crisis here, you need to self-isolate for at least 14 days, regardless if you went to Florida, North Carolina, or, David, just a few hours from here in Long Island, you need to self-isolate for those 14 days. David?
A lot of fast-moving parts. Tom Llamas leading us off again tonight. Tom, thanks.
Okay, and there you go on that video and that report. And that does it for this evening, this Wednesday morning edition of the Riley King Newscast, right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. And I'll have a news report coming up in a little bit. Goodbye, everyone.